Good day, I am Andrea Julie Pascual, student nurse of Pamantasang Lungsod ng Marikina, and I'm going to perform a return demonstration about medical and surgical hand scrubbing. So, the importance of this procedure is to reduce microorganisms that is present in our arms and hands. One of these microorganisms that being reduced is the bacteria flora, which is a resident bacteria in our body. And to prevent cross-contaminations, uh, to reduce or that can cause serious complications to the patients, specifically the surgical site infection or SSI. So before we proceed to the procedure itself, we need to assess first if we have any lesions or scratches or wounds, because wounds and scratches or any opening can be a portal of entry for microorganisms and can lead to infection. The next is we need to check if our fingernails is shortened, because the longer the fingernails, the greater number of microorganisms and dirt that can harbor there. So that can cause infections also. Then next is to remove the jewelry, because jewelry can also harbor microorganisms that can cause unnecessary infections. So I will now proceed in preparation. So the first thing to do in preparation is to make sure that you already worn or wear the surgical mask and surgical cap and surgical goggles. So surgical goggles is not necessary. It depends on the hospital policy. The surgical cap should be placed in the head, wherein the ears is also inside the surgical cap. And all the hair should be kept inside also. Like that. Then this is because if we wear the mask, the goggles, and the cap after we perform the scrubbing, our hands can be contaminated, because we can touch the surface of our face or our hair, and we can rewash, or pwede tayo mag-rewash ng hands natin, or dapat talagang i-rewash natin yung hands natin kasi nga contaminated na siya. Then next is in preparation is to prepare all the equipments needed. So the equipments needed are, first is the liquid soap, which contains a chlorhexamide and povidone iodine, or commonly known as betadine. These two agents rapidly kills bacteria that is responsible for wound and skin infections. And second equipment that we will be needing is the faucet and running water. So there are tendencies that the faucet is not working, so we need to make sure that it is working. So there are five types of faucet. First one is the hand operated handle. So the regulation of water and the temperature is controlled by the hand. The knee level and regulation of the water and the temperature is controlled by the knee. The foot pedal, so it is controlled by the foot, and elbow controlled. Lastly, the infrared. So infrared is automatic, which if it detects a movement, it automatically turn on. So running water should be in low pressure, because if the pressure is too high, it could splash the floor and cause falls for the colleagues or for yourself also. Then next equipment is the surgical scrub brush. So the surgical scrub brush with nail pick. So the nail pick is disposable nail pick is used to remove the between the nail because, like I said earlier, it harbors microorganism and cause infection. Then next is the scrub brush. So the scrub brush has two sides, the abrasive side and the non-abrasive side. The non-abrasive side is used for the skin or the arms and the forearm and elbow. Because if you use the abrasive side of the brush in your skin, it can cause scratches or scrapes. So the abrasive side of the brush is only used for the fingernails. So the next equipment the last and final equipment that I will be needing to prepare is the paper towel. So because I will be using a hand operated handles, and the reason why I need a paper towel because hindi lang ako yung gagamit ng faucet. So we need to use the aseptic technique because we are inside the operating or surgical area. I will now proceed to the procedure itself. So first thing to do is to turn on the faucet. So sira po yung faucet namin, so I need to turn it on sa downward, and wait lang po. So yan. So I will now get the paper towel and turn on the faucet. Then discard this. So if walang malapit na tapunan or trash can, you can just leave it in the sink. Then after that, you need to make sure that you are maintaining a upright position. So sa ating arms with 90 degree angle. So our fingertips should be facing upwards, and we need to maintain this in the whole procedure kasi this is to avoid the contamination because we don't want to touch any of the surface near us. So and remember that the tip of the finger is the cleanest part of this procedure, and the elbow is the dirtiest. So always start at the fingertips down to the elbow. So cleanest to dirtiest style. So I will now wet my hands. So like this. Do it in the other hand. Then put a liquid soap using the elbow. Then we will now continue in rubbing our hands. So first is we need to rub palm to palm. So this is the first wash in this procedure. Palm to palm with the finger interlace. Then this whole washing will last for 2 minutes. So palm to palm with the finger interlace. Then put your right hand at the back of the left hand and do it vice versa. Then with rotational rubbing, put the right hand above the palm of the left hand with the fingers interlocked. So circular rubbing or rotational rubbing. Then do it vice versa. Then we will pass our palm to the thumb and do a rotational rubbing also. And do it in all the other fingers. And repeat on the other hand. with our fingertips, we will rub it in our palms like this. Do it in the other hand also. So starting in our wrist, we will do a circular or rotational rubbing down to the elbow. So sa elbow, pagdating sa elbow, we will go up within 2 inches above the elbow. And do it in the other hand. So we are done. So we're going to rinse our hands starting to the tip of the fingers down to the elbow. So bawal tayo magpabalik-balik because kakalat yung microorganisms or yung dumi. Kasi nga cleanest to dirty. Hanggang sa mawala yung sabon, ulit-ulitin lang. So keep your hand like this, upright lang. Then we will now proceed in the next wash or in the scrubbing. So we will get the nail pick. So we will pick our nails in the running water. So 1 stroke per nails. And do it on the other hand. And then discard. So, yun nga, discard na lang natin sa sink kung walang trash disposable can. Then we will now get the scrub brush. So, i-wet natin siya muna. Then after that, we will put a liquid soap. So using the abrasive side of the scrub brush, we will scrub the fingernails with back and forth stroke with 30 times or with 30 strokes. And do it on the other side. Then place your fingers together like this and do a back and forth stroke again 10 times. And do it on the other hand. Then, at the back of the hand naman, or the dorsal side, 10 strokes din. Then next is the other hand. So next naman is in the thumb and the wrist. We will do a back and forth stroke again with 10 strokes ulit. 10 strokes. Other hand. yung other side naman. So, ulitin to bawat finger. Tigta 10 strokes din. So, other hand naman. So we are done in our hand. So we will now continue in our arm and elbow. So i-divide natin siya into three sections. So the wrist, the mid arm, and then the elbow part. So unahin natin yung sa wrist. So una is yung harap. So 10 strokes din siya. Then likod, ay likod. Then likod. Then sa side naman. Other side. Tapos dito naman sa mid part. 10 strokes again. Tapos dito. Sa likod. So, nag-cut po yung video. So, I'm able to finish my return demonstration, but I will continue where the video stopped. So, yun nga, nandun ako sa part na which is nag-rub ko yung mid part ng arm kasi nga 3 sections siya. So, first, continue lang natin yung ginawa sa my wrist. So, from the front of the both arms, back of the both arms, then the side of the both arms, then we will now continue above or in the elbow. So, yung sa elbow, 2 inch above siya. So, front, back, and then side again. So, I will now perform lang ulit kung paano mag-rinse. So, kasi may sabon pa siya. So, I will rinse the my hands from tip to the elbow. So, like this. From the tip, elbow. So, we will repeat this until the soap is wala na sa my hand. Then, we will let it drop. So, hayaan lang natin tumulo. We don't need to shake it or anything. Just let it drop. Then, in turning off the sink, we can, pwede tayong makipasuyo sa mga tao sa paligid natin kasi or to the unsterile persons to turn off the sink. So, then after that, you just need to keep your hands upright with 90-degree angle. Then, you will now continue in surgical gloving and surgical gowning. So, that's all. Thank you.